If you've ever been told things like you don't have enough milk, or you can't breastfeed if your baby has teeth, then you know how overwhelming and discouraging misinformation can be. The truth is, breastfeeding is surrounded by so many old wives' tales that simply aren't true. So in this video, I'm going to debunk the most common breastfeeding myths and share the facts you should know to feel more confident in your breastfeeding journey. Let's start with one of the most common myths. If you have small breasts, you won't produce enough milk. The truth is, breast size has nothing to do with milk production. The size of your breasts depends on fatty tissue, not the milk-producing glands. Even women with small breasts can produce plenty of milk as long as breastfeeding is frequent and effective. Focus on frequent feeding, proper latch, and staying hydrated rather than worrying about breast size. Another myth is, formula is basically the same as breast milk. While formula is designed to provide nutrition, breast milk is a living fluid full of antibodies, enzymes, and hormones that formula simply cannot replicate. It adapts to your baby's needs and even changes composition when your baby is sick. Formula can be a safe alternative if breastfeeding isn't possible, but it's not identical to breast milk. A very dangerous myth is, you can't get pregnant while breastfeeding. Breastfeeding may delay ovulation, especially in the first 6 months if you're exclusively breastfeeding, but it is not a reliable form of birth control. Many women conceive while still breastfeeding. If you want to avoid pregnancy, use another contraceptive method recommended by your healthcare provider. Another myth is, you shouldn't breastfeed if you're sick. Some people will tell you, don't breastfeed if you have a cold or flu. You'll pass it to your baby. The opposite is true. When you're sick, your body produces antibodies that pass through your breast milk and actually help protect your baby. Unless you have a rare illness where breastfeeding is contraindicated, it's safe and often beneficial to keep nursing when you're sick. Another myth is, breastfeeding is supposed to hurt. Some tenderness is normal in the first few days, but ongoing pain is usually a sign of poor latch or another issue. Breastfeeding should not be unbearably painful. If breastfeeding hurts, reach out to a lactation consultant. With the right technique, nursing should be comfortable. You can't eat spicy or certain foods. While breastfeeding, how many of you have been told, don't eat spicy food, garlic, or dairy, because it will upset your baby? Most babies tolerate a wide variety of flavors. In fact, breast milk naturally changes taste based on what you eat, which may actually help your baby accept different foods later. Unless you notice a clear pattern of discomfort in your baby after you eat certain foods, there's no need to restrict your diet unnecessarily. A very common cosmetic concern is, breastfeeding will make your breasts sag. Changes in breast shape are mostly due to pregnancy itself, genetics, age, and gravity, not breastfeeding. Whether you breastfeed or not, pregnancy stretches the skin and ligaments. A supportive bra and maintaining a healthy weight can help, but don't blame breastfeeding for sagging. Some people say babies need water in addition to breast milk, especially in hot climates. Babies under 6 months who are exclusively breastfed do not need water. Breast milk contains the perfect balance of hydration and nutrients, even in hot weather. Giving water can actually be harmful because it fills their tiny stomachs without providing calories. Nurse more frequently during hot weather to keep your baby hydrated. Another myth is, once your baby gets teeth, you have to stop breastfeeding. Babies can nurse with teeth without causing pain, as long as the latch is correct. Many moms continue breastfeeding toddlers who have full sets of teeth. If your baby bites, gently remove them from the breast and calmly explain, no biting. Babies usually learn quickly. And finally, the myth. If your baby wants to feed often, you're not making enough milk. The truth is that frequent feeding is completely normal, especially in newborns. It's how babies signal the body to produce more milk. Cluster feeding during growth spurts is also common. As long as your baby is gaining weight, producing enough wet diapers, and seems satisfied after feeds, your supply is likely just fine.